Hey there, today I'm going to tell the story of Dr. Ignaz Semmelweis. This is one of my favorite stories to tell in my childbirth education class. I don't always have time for it, but I wanted to tell it to the general public because not everybody knows this story, and it's a really incredible one, a little bit heartbreaking as well, but an important physician to recognize. So, Semmelweis was a doctor who decided to go to specialize in obstetrics, which is a little bit unusual at that time because mostly midwives handled childbirth and doctors were not doing childbirth. Obstetrics was very new, and they weren't really of the mind that they had things to learn from the midwives. They were more like, no, our way of doing things is going to be the correct way because we are men and because we are educated, right? So, midwives didn't go to, they certainly didn't go to nursing school. There was just no such thing. You just learned on the fly. Okay, so Semmelweis was working at this hospital in Vienna, and they had two sections to it. One was for the poorer patients, and one was for the wealthier patients who could afford physician care. In the poorer section of the hospital, midwives delivered all the babies, and they had a very, very low maternal mortality rate. Whereas on the physician side, the rate was very high, and mostly these women were succumbing to what was called childbed fever or puerperal fever. It's a little bit hard to say, so people usually call it childbed fever. If a woman contracted childbed fever, she had an 80% chance of dying, and many women were getting this fever, but only on the physician side of the hospital. So this was the first thing that Semmelweis observed and was like, okay, what's going on here? Let me see if I can figure it out. So he had different theories that he tested, and some of them were a little kooky, but eventually what he settled on was the fact that the midwives were just handling women in labor, and they were not in the habit of putting their hands inside to do an internal exam. Usually the midwifery model, or at least at that time, it was the baby's either in or out. You didn't have to go fiddling around and checking dilation and effacement and so forth. But the physicians were doing things like that. But not only that, they often began their days by doing autopsies. So they would literally go from handling cadavers with no gloves, obviously. This is like the 1840s. So they're barehanded. And I know this is hard to wrap your mind around, but they didn't wash their hands. They didn't know that bacteria existed. You can't see it, so you don't think it's there. So they would go from examining cadavers, doing autopsies, and then going right over to maternity, checking things out, doing pelvic exams, and the whole routine. And that's how they were passing this bacteria. But this was only Semmelweis's theory. He had to dig deeper into it, try to prove his theory, and one of the ways he did was to suggest that the physicians wash their hands when they came from working in the autopsy rooms. And he would have them wash their hands with a lime solution, something very, very strong, kind of akin to washing your hands with bleach, something like that. So I'm sure a lot of the physicians were not really down with that, but they did it anyway, and it showed that the death rate went way down, down to similar where it was in the midwifery wing, so about 1 to 2%. We're talking about maternal mortality, not the babies dying. We're talking about the mothers. So it seemed really logical that this was what was going on. And so he presented his case to a bunch of doctors, and they didn't like it. They pushed back on it. They were saying things like, we are gentlemen, we are educated. Well, are you suggesting that we are dirty somehow? That's literally how it was taken. And so the years went on, and he didn't really have a good concrete way of proving that there was bacteria present. It was more by look, we had people wash their hands and the death rate went down. And then he actually said, well, maybe we should not sterilize, but wash our instruments that we're using in operations and surgery and stuff. Maybe we should wash those as well. And they also found that that made a difference. So anyway, it was really difficult for him because nobody believed him. They carried out his experiment in the hospital, but when the higher up doctors were like, this is nonsense, it's really about something else. They had other theories, like it was like fresh air or stale air was what was causing all these women to perish during childbirth. I mean, the theories they came up with didn't make sense, but of course that's easy for us to say because now we understand bacteria. So anyway, Semmelweis got more and more ridiculed and ostracized by his community. His reputation was under question. A lot of people were very vocally against him, and so he fought back. And he made no friends that way. He lost his job at the hospital. He started drinking heavily, and then he ended up in a mental institution where he perished. Unfortunately, he died right before Louis Pasteur in France and Joseph Lister were making discoveries about what would become germ theory. This idea that there is bacteria that exists in the world, that we can't see it, but it's impacting our lives. So, funny thing is, Lister, Joseph Lister, that's where we get Listerine from, right? Like that's, supposed to kill germs in a mouthwash. So there's that goes all the way back to the 19th century. And Louis Pasteur, the last name Pasteur, that's where we get pasteurization from. I feel like a school teacher. and so that's, those discoveries were happening around the same time, but after Semmelweis had already died in a mental institution. So we're talking about like the 1860s, kind of between 1865 and 1875. This is when this became known, accepted, and employed in hospitals everywhere. And if you can imagine a doctor today thinking that they would ever do a surgery or an exam without gloves and without washing their hands, I mean, even the idea to the average person is really shocking. That's how much the concept of germs is really ingrained in our culture and avoiding the spread of bacteria and so forth. So that's my story for today.